In response to a recent blood sugar test, Linda's been tracking her diet and exercise routines for the past 30 days. Her doctor ordered further testing, and those results helped to diagnose her with prediabetes. Linda wants to know more about how she can manage her new diagnosis to prevent it from progressing further. Prediabetes refers to blood sugar levels that are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. Nearly 6 million Canadians have prediabetes. If left unmanaged, prediabetes can develop into type 2 diabetes, but it doesn't have to be this way. If you have prediabetes, there are steps you can take to try to prevent or delay progression to type 2 diabetes. We've asked Dr. Diana Sherifali to talk about diabetes. Dr. Sherifali is an associate professor at McMaster University in the School of Nursing. Her research program aims to optimize the management of diabetes and quality of life for older adults and people with diabetes across the lifespan. So, what does it mean when we say prediabetes exactly?
So, prediabetes means that your glucose levels are abnormally high. In other words, they're higher than normal, but they're not high enough to actually be diagnosed with type 2 diabetes. So, they're in this in between stage. And historically, people would say, well, I'm borderline diabetes or I have a touch of sugar. Rather than saying borderline or this touch of sugar, we're now defining this as prediabetes. And I think by giving it a name, it also presents an opportunity. And that opportunity is, what can we do to help delay the onset of type 2 diabetes or prevent it entirely?
Can you describe some of the symptoms that someone might be experiencing to suggest that they might be developing prediabetes?
Right. So this is a very difficult thing to identify by symptoms because, quite frankly, many times people just don't have symptoms. Sometimes the symptoms are very vague. They've got a little bit of fatigue. They've gained a little bit of weight over the last months or years. Sometimes there may be changes with their vision, changes in terms of their uh, bathroom activities, going to the bathroom a little more often, particularly at night. And oftentimes these are vague, and we chalk it up as, well, I'm aging, I'm getting older, my eyes are changing, or I'm just tired, I didn't sleep well because I was up going to the bathroom more frequently. So you can see how these symptoms may be ignored, but in totality, along with lab data, it actually paints a quite clear picture that this is prediabetes or type 2 diabetes.
Linda's situation, her doctor seems to have voiced some concerns. And what advice would you have for Linda at this point?
Well, I'm sure getting this news for Linda has not been pleasant, and it probably gave her some concern. The first advice I would give to Linda is this is an opportunity to really understand her behaviors. And with prediabetes, we know that there's an opportunity to prevent the onset of type 2 diabetes or delay the onset. So, with that opportunity, I would start to ask her to journal and reflect on behaviors. And the typical behaviors we look to address are smoking cessation. So, if Linda smokes, thinking about quitting would be this would be an opportune time. The bigger issue here is weight and weight management. So we know that if people are able to lose about 5% of their total body weight. So if Linda is, 200 pounds, for example, or someone is 200 pounds, what does that look like? That's about 10 pounds of body weight can actually make a big shift in their glucose levels. And quite frankly, in their cardiometabolic levels, such as blood pressure or even cholesterol. So sometimes that's quite daunting to think about. Well, how do I lose weight? I've tried to lose weight. How do I journal? How do I reflect on my behaviors? So I would encourage Linda and her healthcare provider to really seek out some expert support. And I would first and foremost ask to have Linda referred to a registered dietitian and talk to a registered dietitian about healthy eating. So healthy eating doesn't comprise denying yourself foods. Linda can certainly enjoy a barbecue, or ice cream or birthday cakes. We're all interested in joining our loved ones and celebrating these milestones, especially with COVID and after COVID. So I think really understanding what is healthy eating, quality of foods versus quantity of foods, and really getting past some of the myths about keto diet, some of these fad diets that may be out there, but working to find a tailored approach that fits Linda's needs. The other piece then would be to even refer Linda to a registered kinesiologist or someone that could help her with her activity levels. So getting moving, keeping active is vital in terms of maintaining body weight, but also it's a nice has a nice benefit and a profile for other cardiometabolic factors such as blood pressure, weight, even mental health. So getting her active, more steps, physical activity with maybe some mild weights, but really designing a program that fits her from a lifestyle perspective.
So it sounds like pre-diabetes with these important kind of lifestyle and healthy lifestyle interventions can alter the trajectory and either delay or prevent the onset of diabetes.
Absolutely.
Are there any other strategies that might be helpful?
Yes. So in Linda's case, this is very interesting. She is actually journaling and keeping track of what she's doing in terms of her eating habits, perhaps her physical activity habits. Sometimes what helps people to further understand their behaviors is actually getting a blood glucose monitor for home purposes and starting to track their glucose levels. And what we can do is we can map out what do certain foods do to their glucose levels, what do certain activities do to their glucose levels? And this is always insightful to give people a big picture in terms of what's actually happening. So, in some instances, healthcare providers may encourage individuals to actually get a glucose monitor and test. You can test before meals, you can test 2 hours after meals, you can even test after going for a long walk just to see what that walk did to your glucose levels. All that information is insightful. The other thing we're starting to also see quite regularly is the prescribing of medications typically used for type 2 diabetes for prediabetes. And a lot of this comes from more and more evidence that is suggesting that new medications we use for type 2 diabetes actually help people maintain, if not lose weight. So we know that one of the strategies to prevent or delay the onset of type 2 diabetes is losing weight. Why wait until you have type 2 diabetes? Why not get access to that medication at the pre-diabetes stage to further prevent and delay the progression?
So, combination, healthy lifestyle factors, and using sort of best evidence strategies to engage in behavior change, because it's always easier said than done, but also more regular monitoring, which may give you a better sense of the impact of lifestyle changes or diet and activity on your glucose levels, and possibly even medication strategies that might help in the pre-diabetes stage, possibly through the reduction in weight or improved weight management.
Agreed. So you can, just from that recap, you can see that there's a lot of opportunities and strategies. I think the best advice I would give Linda now is to really talk to her healthcare provider about what is the best plan for her moving forward, and what is going to set herself up for success. And success comes in many forms, whether it's taking more steps a day, whether it's making small changes to her dietary habits and how she eats. Um, so I think it's really a tailored plan and using the strategies to help her.
You mentioned like some of the important allied health professionals, like a registered dietitian and a kinesiologist. There are diabetes educators. Would most people who might be diagnosed with pre-diabetes, would they have access to a diabetes educator? How would somebody go about finding that, or are there other resources that somebody with pre-diabetes could access?
Great question. So I'll start with the diabetes educator piece. So in Canada, all diabetes educators that are certified go through a rigorous exam. and they are board certified. So you'll see three letters after their name. So, for example, Diana Sherifali, CDE, Certified Diabetes Educator. And anyone that has a regulatory college, so this is a bit of a big concept here, but a regulatory body or license can be a certified diabetes educator. This could be a family physician, could be a pediatrician that manages children with diabetes, a social worker, a nurse, a dietitian, a registered kinesiologist. All of these individuals comprise licensed healthcare professionals that can become a certified diabetes educator. And so, what does that mean? What that means is that they have a level of understanding around what's happening to the body, whether it's type 1 diabetes, type 2, or gestational. They also have a good evidence based knowledge and framework to take knowledge and evidence and actually use that to help people create positive behavior changes. So, in Linda's case, if she could access a certified diabetes educator, that would be a fantastic opportunity for her. We know that we can access certified diabetes educators through referrals, and that can be done through a primary care provider. Some diabetes education centers will take self referrals. So if Linda chooses to self identify and go in as a self referred individual, she could have access to classes, group classes, one on one counseling. I'm sure there's lots of online opportunities now, and I think sort of the foundational place to go for any further information that's evidence based is through Diabetes Canada, and that website can be found perhaps afterwards in a link. But these are all strategies where Linda can empower herself through evidence based knowledge that's disseminated through healthcare professionals that are credible and reliable.